So in this image, there's not all of the joints in the body listed, but it gives us the big ones. So starting from the bottom, and actually underneath the ankle would be the foot. All right, the foot would be an example of a stable joint. The joint above it, the ankle, mobile. Above that, knee, stable. Above that, hip, mobile, so on and so forth. Now, what we find is if a stable joint becomes unstable, or if a stable joint becomes mobile, it affects the joint above it. For example, if the knee loses stability, the joint above it, the hip, which should be mobile, will then become stiff or stable. And that's a huge problem for golfers when it comes to creating good turn and movement, right? So when we're working with a golfer, our job is to make sure that all these kinks in the chain fall in line, right? And that also promotes good movement. So we go back here, all right? We see stable foot, mobile ankle, stable knee, mobile hip, stable pelvis. When we talk about the pelvis, we're also talking about the lower back, right? We kind of consider that one region. We have a stable pelvis. We'll have a stable or mobile thoracic spine where the bulk of our upper body or trunk rotation comes from. Out from the thoracic spine, we want the shoulder blade, which is the scapula, to be stable. That kind of anchors the arm to the rib cage. If the shoulder blade is stable, it allows for good mobility within the shoulder. If the shoulder is mobile, good stability in the elbow, which leads to good mobility in the wrist, which leads to good stability in the hand, right? So if you think inward on yourselves, and if you have a joint that bothers you, or a stiff, let's say a common example here would be a stiff hip. A lot of people complain about having hip stiffness. That person, if that's you, probably also complains about lower back pain. Because the hip is stiff, it creates a stability issue in the lower back, which then results in dysfunction and pain, right? So this concept of stability and mobility is really important to understanding good movement within the golf swing. Okay, so from here, we're going to get into the 12 functional movement tests that we use for golfers to get a picture on their body strengths, weaknesses, and limitations. As I commented on earlier, each one of these 12 tests relates to an issue within the golf swing. It's not to say that if you were to fail one of these tests that you would definitely suffer from the swing characteristic associated, but you'd be more likely to have that swing issue. So Greg is going to take it from here. He's going to show you maybe not all 12, but the majority of these tests. And as he's doing this, I want you guys to perform these tests if possible. If you have enough space around you, I want you to get up, perform the movements just so you experience it for yourself. And then we'll ask you guys some questions afterwards. Okay.
All right. Yeah. So as Jason said, I would highly encourage you guys to try these things. And the other thing I want to kind of preface this with is normally I wouldn't just have everyone do these tests blindly. I usually make sure that what injuries there are and things like that before we start doing all of them. So if you have any injuries, don't feel obligated to take part in some of these tests. And at some point, we're going to put a poll up on one of the tests specifically. So the first one I'm going to talk about, and I'm just going to kind of go down the order. I'm not going to go through all of them, but the bridge with leg extension test is probably one of my favorite. It's fairly simple. So I'm going to try to make sure I stay in stream here. But the simple part of the test is we try to instruct it the same way. Is your knees are going to be, your feet are going to be directly under your knees, hip width apart, hands up off the ground. Usually I should simply ask somebody to bridge up. And when they're ready, extend one leg. Okay? And I'll have them hold that for about 10 seconds. And I'll have them come down, completely reset, and start from scratch, hands up, bridge up, and extend. So what we're looking for in that test is basically glute strength. What we try to find is if we see a major hip shift. So if I go to extend one leg and the hip drops, that's a possible stability exercise. The other thing we tend to see is if you go into a leg extension and your hamstring immediately goes into a cramp, or by the time you're done 10 seconds, it starts to feel like you're cramping. That tells us we have a weak glute. All right. probably two of the most important things when it comes to the golf swing is that glute hamstring relationship. Oh, actually, yeah, I'm glad, Len, you mentioned that. So if you can't see me, scroll over my name, click that little pin drop, and it should bring me up. The leg lowering test I am going to skip. It's not the most exciting thing to see virtually. What do we get here? Hip rotation test. Let's do the pelvic tilt test. So I'm going to go through a couple series. I'm going to make sure I'm a little bit closer. Normally, I'd want to see everyone's full body, but I'm going to get a little bit closer so you can see what I'm doing. So there's 3 hip and pelvis tests. One is the pelvis rotations test. So I usually tell people, pretend you're buried up to your waist in cement, stabilize the pelvis. Sorry, torso rotation test. Without moving the pelvis, I basically just want to see how well you can rotate the torso. And again, what I'm looking for is, do they have the ability to rotate equally on each side, or do they have one of those symmetry issues, or do they have an inability to disassociate hips and shoulders? Okay? So that's just, I see a couple of people testing. All right, not bad, Fran. All right, the second part of this is the pelvis rotation test. So now I want my upper body to stay still. Right, with my upper body staying still, I want to see how well I can rotate the pelvis underneath me. All right, so again, I'm looking for how far I can go in each direction, whether it's tight or if I can't disassociate between the two. And then the last one of this little sequence is a pelvic tilt test. So I'll ask people to get into the same golf posture, arms across the chest. I'll look at their neutral spine, their golf posture first, and then I just want to see how well they can perch and then round. Okay, I'm going to come closer so you can see my actual pelvis. I shouldn't see a tremor coming underneath or a shimmy. And I also want to see if you can have good movement in both directions. And with those 3, Jason, do you want to talk about kind of the correlation between the hip shoulder separation and before I jump on to other stuff?
Yeah, absolutely. So starting with the first test that he showed you, he was down on the ground, he lifted his hips up, and he extended one leg out. That's called the bridge leg extension test. That's a foundational movement, a foundational test for everything else that follows, right? So again, as he said, that test measures for glute strength. The glutes, which we'll learn later, are called the king muscle of the golf swing. They are the single most important muscle group for golfers. They provide the pelvis and the spine with stability, and it provides us with the ability to set up and maintain good posture. Right. So if we see a golfer fail the bridge leg extension test, meaning they have weak glutes, we could expect a poor setup. We could expect loss of posture in the golf swing. We can expect a lack of power generation. Right. So that's a bridge leg extension test. The next ones that he showed you were the rotational test, starting with the pelvis. The last one he showed you was the pelvic tilt test. A golfer that can't pelvic tilt well will not transfer energy from their lower to upper body the way that we want to see. With that, we'll see loss of posture, poor pivot, flat shoulder plane, right? So the ability to move the pelvis, again, very important for consistency and power creation. Pelvic rotation, right? Do you have the ability to turn your hips without moving your shoulders? As we know, that's very important, right? When we look at the transition from the backswing to the downswing, I'm sure most of you would want to see in your golfers a little bit of separation. We want to see the lower body move occur first. Well, if your golfer can't create separation in that isolated, contained environment, right? If they're getting golf posture and cannot turn their pelvis without their shoulders moving, it would be hard to anticipate or to expect them to have a well-sequenced and efficient downswing, right? That affects efficiency, which then affects your ability to generate distance. It also is going to affect durability of the golfer because they end up getting their spine and their lower back a little bit too involved in the swing. And then the last one he showed you, just the opposite part of that. Can you turn your shoulders without your hips moving? Again, is necessary to create good separation and a good upper body turn in the golf swing. Somebody that can't do that is probably tight through their spine or weak through their core and hips.
So if I move on, and just so you know, I do want you guys to kind of testing these at home. But at some point, if we have time at the end, Jason may actually ask for a volunteer. We may put you through some of these things as well. And I want to keep going down the line because the toe touch test is really important, as Jason explained. So again, if we can, I'm going to have everyone do this, and Jason's going to put up a poll question. It's a simple yes or no. All right. So to properly perform the toe touch test, you're going to start with your toes and heels touching. Okay, so this changes the test. So it's always important to start the same way. Your toes and heels are going to be touching. I like to stack my fingertips on top of each other so that I know that I'm centered. And without bending the knees, I simply want to reach down and see if I can touch my toes. Okay, so it's simple as that. So I'll show you again. Toes and heels touching, fingertips stacked. Without bending the knees, can you can. If you feel the knees flexing, that's a no. If you obviously can't touch, that's also a no. If you're struggling to breathe and barely touching, that's most likely a no. We find that some people try to cheat this a little bit. All right, so if you can, and then once enough people answer, we'll actually show the results. And as you guys are testing yourselves, I'm going to go on to the next test, the overhead deep squat. Another one of my favorites. And again, if you have bad knees, I may not have you do this test, but if it's something I still want people to do, there's other ways to do it. So the deep squat test is fairly simple. This is not how I would squat in the gym. Everyone has different hip angles and things like that. The purpose of the deep squat test is to analyze things. So I always want to set people up the same way. So I'm going to make sure my toes are lined up with my hip bones. So my feet are about directly underneath my hips. And I'm going to have my arms directly overhead. The only instructions I'm going to give you is I want to make sure your heels are on the ground and your arms stay overhead. And I want to see simply how deep you can squat comfortably and come back up. Now, normally I'd look from this front view, the side view. I know it's not polite to butt to the camera, but I do want you to see something. If you're looking from the side and I see this going on, or from the front, I see a collapse of the knees, of all of the torso. These are all things that we may need to break out other tests to determine. And then let's see, how's the poll going?
Apparently only 4 people tried to touch your toes.
I'm going to show, oh, now we got a couple more.
So we're 3 no, 3 yes.
I'm going to allow people to see the results. So typically when I do these type of talks, we get close to 50%, right? So even if this entire room did this and it ends up being close to 50%, as Jason said before, this is not a direct correlation, but a causation of certain things in the golf swing. So knowing that, most people just assume they have bad hamstrings and they don't bother correcting them. So this is definitely something that you could still improve on. When I work with a lot of general public, if you can't do a toe touch, you're at 80% higher risk of some type of back injury. Doesn't mean you're going to get injured, but it means you could. If you can't do a toe touch and you can't do a deep squat, that rate goes up to 90+% of most likely getting a back injury. So you're basically expecting a bad back. Doesn't mean you're going to get one. So if you can start correcting these things, obviously not only will it make you a better golfer, but even if you're playing with your grandkids in the backyard or doing something on the weekend, you're more safer, you're less injury prone. And Jason, is there any other tests specifically you wanted me to run through?
Let's do the single leg balance test too, Greg.
All right. NorCal knows this one. I've done this one live, so I might as well have everyone do it. So this is also kind of one of my favorites. It's a good, simple one to do. You can even do this with a lot of your players on the course as long as you have level, firm ground. But the balance test is, again, I'm looking for specific things, so I'm not going to let them use their hands and arms as outriggers. So I want their hands at their side or across their chest to keep their hands out of play. And all I'm simply going to ask is, do they have the ability to lift one leg up and hold their balance? Right? If they're able to do that for 10 seconds, I'm going to ask them to lift their leg up. So for those of you with their hands out, because I can see a few people with their hands out, arms down, arms up. And if everyone's comfortable, when I say close your eyes, I want you to close your eyes and try to hold your balance for at least 15 seconds. Ready? Yep. Right, so again, everyone who has their arms out here trying to balance, bring them down to your sides. Arms are not allowed. So what that does, that gives you more balance. I want to know what's going on with the core and the leg. Right? This makes it a little bit easier. All right, go ahead and take a break. And just for balance and symmetry, let's try the other side. If you can know how many seconds you could do. All right, so same thing, arms to your side or across your chest. Whichever leg you didn't do before, bring that leg up. And when you're ready, eyes closed. I see a couple people falling over the wiggle wobble. So now I didn't tell people right leg or left leg, but it definitely looked like a few people had one leg harder than the other, for sure.
All right, thank you, Greg. So with those tests, all right, we'll bring every golfer through those tests, and from that we can determine whether or not they pass or fail a grade or a golf fitness handicap. So if you fail a test, you get up to a 3-point I would say not really deduction, addition. It could be somewhere in between 0 and 3. Maybe if you failed certain elements of the test, you'd be scored a 2 or 1.5. If you fail those tests, you would be scored a 0. And with that, we calculate a golf fitness handicap. And we use that golf fitness handicap to somewhat objectively determine the outcomes we could expect with a golfer. For example, if we're working with a golfer who is a scratch handicap, they're 0, but their fitness handicap is a 27, then we can pretty confidently we can tell that golfer that by improving their functional movement, they will become an even better golfer. I think Greg would agree in that scenario, we love that, right? Because we know they've been working with you guys. We know their technique is sound. We know they have the right equipment. We know they have the right mental game. The only thing missing is fitness, right? So pretty much any goal that golfer has when it comes to performance goals, distance, consistency, we'd be able to take care of just by improving their functional movement. Now, if we're working with a golfer who is let's say a 22 golf index or golf handicap, and they do pretty good with the functional movement testing, they're let's say a 6 fitness handicap, then while there's certain things that we could help that golfer with, our primary advice to that person is to go see people like yourselves to take more lessons, right? At the very least, we won't be able to promise outcomes from a golf performance standpoint because their technique isn't good, right? They need lessons, they need more time playing. So we have that conversation with every golfer that we work with, and the foundation of all these programs that we go through and all the goals that we set are really determined by this functional movement screen. All right. The few tests that he didn't put in there are shoulder rotation test, lat length test, which to determine what the arms or how the arms are going to work in the golf swing. But the ones that he covered are the foundational tests that are really going to tell us the most about a golfer and their body. All right, Greg, you have anything to add to that?
I think the other thing about these tests, and for those of you who are not TPI certified, these are simple tests to learn. They don't always necessarily need to come directly to us to do a toe touch test, but it may give you something to take your client through and realize they have tight hamstrings, and there may actually be a physical limitation that's causing that, and you could dig deeper into that. So these are very powerful tests for you guys as well, not just us as fitness professionals.
Yeah, that's a great point. I should have mentioned that. These are things that we would love for you guys to actually apply and use with your students. We can't fit every golfer into the same mold. So just even having a somewhat familiarity with their body and how it moves will help you make more informed decisions on the best way to coach or instruct your golfer. I think that's really important. And it helps you get more outcomes, less frustration. So really good tool for you guys, these tests. All right. So we're going to get into the faults and fixes part of the lecture here. Len, do you want to go for a couple more minutes, or did you want to break now?
I think, Jason, if you feel that this is a good spot to stop before getting into the next topic, why don't we do that?
Okay. Yeah, I think it would be.
Okay, everybody, we've got 10:36 on the clock. Let's come back at 10:45. Okay, thank you.
Thanks, guys.
There it is. All right. Oh, man.
No, don't forget
That would be me.
you're on mute.
Jason, now I can be unmuted, but it doesn't really matter anymore.
Yeah.
So your presentation was saved. I don't have to talk.
Yeah, right. We would have ruined
All
the
right.
whole thing.
Yeah, right.
We're just gonna have you talk at the end, Fran. You're not off the hook.
Oh my, it doesn't work again. Yeah, it was on my side, my microphone side. My bad. So I can come back in if needed, okay, guys?
Yeah, we'll catch you at the end, Fran. Absolutely.
Alrighty.
I had a question if you could hear me.
Sure, Steve.
I'm a decent golfer, but like just doing that toe test, I couldn't get within 8 inches of my toes.
Mm-hmm.
This golfer handicap thing. I'm a big believer that I can't play as well as I used to because of my physical issues. I've got major back issues, and I struggle playing more than a couple days now. It used to just be a day, but I've gotten better, and I can play probably 2 days in a row. It's hard for me to play more than that unless I start popping the ibuprofen, which I hate to do. And so my question is if I go through some program, this TPI program, with someone who's certified in my area, do I have a likelihood of getting better? Or, it's not even getting better. I'm 55 now, and I can see the deterioration of my game. I wouldn't say daily, but yearly. It definitely shows itself on a yearly basis. To extend my time, maybe till I'm 60 or 65, where I can play half decent.
Hey, Greg, you want to answer that?
I was just gonna say, do you want to take this or should I? Okay.
Go ahead,
Steve,
Dave.
if you don't mind me asking, where are you out of?
I'm in Reno.
Reno. Okay, so obviously Sacramento is still a little bit of a drive, but first
I
of all,
go there a lot though, especially in the wintertime. We'll pop over the hill and play some golf.
yeah, my first question is, if you have any physical limitations, there's always the ability to get better. If you had a hip replacement, that might be one thing or something like that. But when we do these tests, and I usually tell people, I wouldn't do these tests unless I think we can make things better. Doing a lot of just general, I'll take golf out of it for a second, doing a lot of general fitness and anti-aging. What we find is people come into me, I'm 43. People come into me age 40, 50, 60. Well, I'm losing my mobility as I got older. I'm losing my strength as I got older. But the reality of if you don't use it, you lose it. If I were to ask you, how often do you stretch your hamstrings?
0.
Could you say you there? So my question would be, do you have tight hamstrings because of something else? Or have you just lost mobility in your hamstrings and is now affecting your back, kind of like Jason had said, because one thing affects the other?
I'll be honest, I might have been able to touch my toes in junior high.
So you had it. The key is you have to keep it. I work with a lot of 65, 75, even 85-year-old, not only golfers, but baseball players. And they wear the shirt that says, you don't stop playing when you get old when you stop playing. And the reality is, as soon as you stop doing flexibility work, mobility work, strength work, you'll lose that feature. The same thing with strength training when it comes to muscle mass and building. You can absolutely build muscle at any age. especially if you haven't strength trained in years. So the key for you would be to go through a program like this or TPI, learn what's going on. Why do you have tight hamstrings? Fix that cause. So if you were to fail that glute test that I showed you and you have tight hamstrings, those things can go hand in hand. So my very speedy answer is yes, you can absolutely get better. And this is where the injury prevention comes into play. And most people that go through programs like this prolong their career by decades, not just a few years.
Okay. Thank you.
So there's also
Jason,
Steve's being a little modest here too, because about 48 hours ago, Steve won our 2022 Senior Match Play Championship. So Steve,
Yeah.
congratulations on that.
Thanks, Len.
Yeah, absolutely. Sorry I wasn't there to shake your hand, but well done, Steve. Well done. I'll see you in a couple of weeks.
So his goal is to win the 2030 as well.
That's correct. That's correct. Yep. Okay, it is 10:45. Thank you all for being with us so far, and we've still got plenty to go. Steve, thank you for the question again. Congratulations to you, and I'll turn it back to Jason.
Great. Thanks, everybody. Couple things, a couple housekeeping points before we continue. I put up another poll. What percentage of your students complain of back pain or stiffness? 0 to 25, 25 to 50, 50 to 75%, or 75 to 100%. Would like to see what you guys have to say about that. Also, at the end of the presentation, we are going to ask for a volunteer for a live case study. Essentially what we'll ask you, what Greg's going to ask you, is a little bit about your golf swing, some of those common swing faults that you may suffer from, some of the body stuff that's going on. And then we'll actually personally take you through some testing just to show this live so you get an even better understanding of the way that we look at golfers. So if you think you may be interested in doing that and learning a lot more about yourself and also some ideas to improve, just keep that in mind as we go to the end. It'd be great if we got at least one volunteer. Okay. All right. So in kind of part two here, we're going to go through common swing faults and body fixes. So what you'll learn, obviously, I don't need to teach you any of what you're seeing right now. You guys know these swing faults. You know how to coach them up from a technical standpoint. What we want you to understand is some of the body limitations that are potentially behind these swing faults. So we'll go through all these individually, and Greg is going to show you as we go along, actually specific exercises you can do for yourself, or you can show your students if they do have some of these issues, right? So again, you guys are the experts in fixing these things from a technical perspective. You guys are great in getting a golfer to understand positions they need to be in or the way that they need to move in the golf swing. Even if there's a golfer with physical limitations, they may be able to eliminate these faults, but they'll be able to move more efficiently and get rid of these issues quicker, right? If their body's in better shape or their functional movement is more proficient. So what we're going to cover first here is unbalanced setup. We're going to talk for a few minutes about this concept of trail side hip high. And then we'll go through poor pivot, turn, flat shoulder planes, explain what physical limitations lead to them, and what you would need to do to fix them, whether it be for yourself or for a student. So again, if there's any questions along the way, just type in the chat box and we'll try to get to them as we go along here. All right, so I want to spend a little bit of time on this concept of trail hip high. Through a lot of research and studying, actually a lot of this done by my partner David Ostro, going back to the 90s. What we've seen and kind of explored is this concept of symmetry or asymmetry within the body. And what we found is, regardless of demographic, I shouldn't say demographic, we're talking about people 16 years and older, but regardless of male, female, geographical area, blue collar, white collar, athletes, non-athletes, we see 90% of the time an asymmetry in pelvic height. So what we found is that over 90% of people around the world have a right hip or right side of their pelvis that's higher than the left side of the pelvis. We wanted to bring this up because this causes a wide array of issues for the golf swing. What we found, again, 90% right hip high, about 4% left hip high, regardless of left-handed, right-handed, left-footed, right-footed, and about 4% of people have actual balance or level hips. So actually, one of the things that you guys can do to get a good idea for this on yourself is if you stand up and you place your hands right on the top of your hip crest. So you kind of go from the bottom of the rib cage and then slide down. You're what's called the iliac crest. And that's what we look at in a standing position and in a lying position to see if the golfers have a level pelvis or an off or an imbalanced pelvis. Now, you may need a mirror in front of you to really get a good look. The difference is usually about an inch, maybe less. But that difference is significant enough to cause, like I said, a lot of issues with the golf swing. So, maybe see if you're high, low, level. What we find is that the majority of people that walk through our doors have an unlevel pelvis. Now, the cause of this is muscle imbalance. So around the pelvic bone that you guys are feeling there, in the front of it, you have a hip flexor. Behind it and above it, you have a lower back muscle called the quadratus lumborum. And those muscles with these folks get really tense or overactive or short and tight. And all those things mean slightly different things, but the premise is those muscles are overused or overactive. A lot of that comes from the way that we work, the way that we sit, and just the general sedentary lifestyles of the 21st century. Now, opposite of those muscles, we have the hip flexor in the front, which I'm sure most of you are familiar where that is. Behind the hip flexor on the other side of the body are the glute muscles. When the hip flexor gets really tight, the glute muscles get weak or inactive. So that's the problem behind the hip flexor. If we go to the lower back, which of course is in the back, the muscles in front of that are the deep abdominal muscles or the lower abdominal muscles. So if we have a tight lower back, the muscles in front of that, the deep abdominal muscles, get really weak or inactive. That a lot of people will call lower cross syndrome. When we have those issues, tight hip flexor, tight lower back, weak glutes, weak abs, that's what causes that pelvic asymmetry, right? And we're actually going to show you a couple things. If you do notice this with some of your students, we're going to show you a couple exercises to fix that. I see mixed results. Some people, we can correct it just with a little bit of stretching and a little bit of core and glute activation. Others actually require hands-on work, manual therapy, massage, deep tissue work to make that correction possible. I'm going to show you from a golf standpoint what that looks like. So obviously we're looking from a behind view of a golfer in their setup, totally unaware of what is going on and what we were looking at. And here you can clearly see how his right side of the pelvis and trail hip is higher than his left, right? To the right of that, you'll see that standing. It's kind of hard to tell, but that right hip is also higher. And the majority of the time, it's going to be right hip high. Now, if you saw with a golfer issues such as a poor hip pivot, poor separation in the backswing, loss of posture, flat shoulder plane, or if you saw the inability for that golfer to get their right hip or their trail hip to the left in the downswing, a lot of that can be fixed by creating level hips, right? So that's something, if you see those issues and you want to do a quick body test with your clients, is just put your hands right on top of that bone, the iliac crest, and see if they're level or not. And again, it's really hard for a golfer to move well and to rotate well when this happens. And because it's so prevalent, we think it's really important that you guys are aware of this. And also that you know or can suggest some ideas to help them fix this, right? As I just kind of commented on many of this trail hip high concept leads to poor separation, flat shoulder turn, poor pivot, poor rotation of the pelvis to impact, and weight shift problems. Now, the poll I asked you guys, what percentage of your students complain of back pain? I asked that because of the topic that we're on now. So it looks like it's pretty well spread out. 3 votes, 25 to 50%, 2 votes, 50 to 75%, 2 votes, up to 100% of students complain of lower back pain. Up to 90% of the population have a pelvic alignment issue. We see, and sometimes here we're reporting, 50 to 100% of your students complain of back pain. Where we see the right hip high, we'll see back pain on that side. If the left hip is high, we'll see back pain on the left side. Now, that's a problem, right? If you have a student that has back discomfort, pain, whether it be minor or severe, it's going to affect their level of play, and it may even affect their ability to play, right? So you're starting to see the significance of this issue here. There's a huge correlation between a pelvic asymmetry or a trail hip high, which correlates to back pain. If you guys can help your students fix this and eliminate back pain, it means they're going to golf better and they're going to play more, right? So again, we just want to give you some tools to understand this and learn how to address this with your students. Fixes, and Greg is going to go through a couple exercises with you in a moment. As I mentioned, some people, maybe 50% of people, require manual release or massage and manual stretch of those tight tissues, the lower back and the hip flexor. Everybody with this issue is required to strengthen their glutes or activate their glutes and their abdominal muscles. And really, when we're addressing this, it's all done on the affected side. So if we see a trail hip or right hip high, all that work's going to be done on the right side. In the rare case, it's left hip high, all the work's going to be done on the left side. All right, which is relevant because if you go to a student and see that they're on level right side, these exercises, you want to have them perform on their right side, but not their left, right? There's no need to do it on the side that's not affected. That way it takes less time to actually do these out on the range. So we're going to show you a couple of exercises. Greg, do you want to show them maybe like half kneeling hip flexor stretch, some type of QL side stretch, and some bridge progressions? You're muted.
Take 2. All right, here we go. Sorry. So the half kneeling hip flexor stretch is probably one of my favorite stretches. I feel like almost 100% of my clients have to do it. The main reason is we sit way too much. Even myself, over COVID, found myself sitting for the first 6 months and everything started tightening up. So it's something that we should be doing on a regular basis. For most of you who have golfers that have desk jobs or driving jobs, these things are going to get tight. So to get into position, it's literally called the half kneeling hip flexor stretch. So I'm going to start in the half kneeling position. Now, what most people tend to do this is they shift forward or lean forward, or they try to arch their back, right? In order to get your hip in the right position, Jason talked about that muscle that comes through your pelvis and attaches to your back, the hip flexor. I'm going to, if you can see my belt line, I'm going to pull my pelvis up. So my belt buckle is going to come up towards my chin, and I'm going to use my glutes to pull the back down. Just by doing that, without shifting forward, I should immediately start feeling stretch in the front of my hips. And then if you are a little bit more advanced or you do have a little bit more mobility, you can shift forward, not by arching your back. That attachment point, if you arch your back, you're changing the muscle that you stretch. So it's important that your spine stays upright, scoop the hips underneath you, and just a gentle shift forward. And if you guys are doing that, you should feel that right where your front pocket would be. As far as a quadratus stretch, I'll kind of demo this in case nobody has all this exercise stuff at home, but this is actually one of my favorite ones, to where if I'm in frame here with my little post, I like taking, my right side is my affected side, I'm going to take my right hand, put a thumb down on a door frame, a post, and I'm just going to push my hip as far back as I can. I also have a lot of people do this on the golf cart. Don't pull the golf cart over, right? I'm going to push my hip as far back as I can, and then as I rotate underneath, I'll start to feel right in this back, right where this quadratus area is. Right? That's a fairly decent one. If you do have either a chair or a ball. Another one of my favorite ones, a lot of people have these to sit on. don't fall off. That's a whole other problem. But I'll extend over the ball and I'll just reach. So again, depending on where you're tighter, if your QL is where you're tightest, you'll feel this right in that QL area. So a lot of this, so that's part of the stretching of the hip flexor in QLs, right? The second part that we talk about is strengthening the glutes, right? I'm going to have everyone test themselves for a second. I like this one. All right, do me a favor. If you guys are sitting or standing, take your hands and grab your butt cheeks. Please do me a favor, keep them on your own butt cheeks, nobody else's if there's anybody else in the room. And try this. If I were to ask you to squeeze your glutes, I don't mean take your hands and squeeze them, but can you contract your butt muscles in your hands? Those are your glutes, okay? If you can feel that, try to squeeze just your glutes. You shouldn't feel your hamstrings kick in. You shouldn't feel your core. I shouldn't see weird faces trying to squint. The glutes, the whole glutes are nothing but the glutes. And if you can still do that, when we're looking at activation, can you squeeze just your right glute? Hold that for 5 to 10 seconds, relax, and just your left. Now, for those of you who couldn't do a toe touch, this may be another problem. So now we're seeing this glute-hamstring relationship. So I actually teach this as an exercise. It's a glute activation or a glute contraction. Once you have the ability to contract your glutes, then you can go into an actual bridge. So again, when I do a bridge, it is a glute bridge, not to be confused with a low back or a yoga more arched bridge. So I'm still going to work on taking that same belt buckle up towards my belly button. And I like to press my hips towards the wall behind me, and that helps activate my glutes. When you lift towards the ceiling, you may tend to arch your back. So activating my glutes, and the same thing, just like you squeeze your glutes in your hands, you should turn your glutes on to lift your hips. And then from that position, there's numerous different variations of bridging that you can do. But we're talking about activating the glutes and lower abdominals that tend to get weak, and talk about stretching the hip flexors and low back that tend to get tight that Jason talked about in the lower cross syndrome.
Yep, great. Thanks, Greg. So again, just to reiterate, the objective when working with a student or a client that has a high hip, again, most times it's going to be right hip, right-handed golfers, trail hip. It's to stretch the front of the hip flexor, stretch kind of that side lower back area, which Greg showed you. And then immediately after, activating the glutes. And that can be done as simply with just teaching them or telling them to work on contracting and squeezing the glutes, which I bet a lot of you couldn't do independent glute squeezes. We see that all the time. And then something a little bit more in depth, like a glute bridge to facilitate activity of those muscles. So all these things, maybe aside from the ball stretch, can be done on the range in about 2 to 4 minutes. Try these out either on yourself with a student that needs them, and then recheck alignment. More times than not, we'll see the pelvis symmetrical, right? And that is also a sign that these are the exercises that need to be prescribed away from golf for these students as well. All right, let's continue. All right, so a conversation about the king, queen, and emperor. I know some of you haven't been through TPI certification, but this concept of the king and queen muscles are addressed with the TPI level 1 classes. And then we've kind of coined another term, the emperor, which I want to talk about a little bit today, and talk about how the emperor or the equilibrium system plays a huge role in the golf swing. All right, so Greg Rose of TPI coined the glutes, the king muscle, because it's a single most important muscle group for the golf swing. And probably the second most important muscle group are the abdominal muscles. The glutes and abs stabilize the pelvis and lower spine, right? Which creates a sound foundation for a golfer to pivot, rotate, transfer energy and power. So if those things aren't active or weak, a lot of other things go wrong in the golf swing. A lot of other things go wrong in functional movement. That's why we spend a lot of time talking about the glutes and abs. Now, the third component that we really look at, the emperor, we're talking about the equilibrium system. So the primary goal of the equilibrium system, again, we kind of talk about the nervous system here, the brain, the nerves, the spinal column, feedback systems from muscle, tendons. The primary goal of this system is to keep your head up, right? or in other words, to keep your head off the pavement. If the equilibrium system isn't fired or tuned the right way, then we can expect that these muscles that we're talking about, glutes and abs and these joints and the movement, we're talking about mobile joints and stable joints, we can expect for those systems to not work optimally, right? So when we're training people, balance is super key. And I'm going to ask you guys in a second about your discussion with your students about where you feel like their weight should be, where their balance are going to be in the golf swing. But if we find that this system is off a little bit, then weird things happen. Injuries occur, movement patterns are compromised, and the swing becomes less efficient and less consistent. All right, so let me give you guys another poll. This is going to be really interesting. What do you guys instruct? Or you could just type this in the chat box or speak out loud. What do you guys instruct in terms of where you want your students' pressure to be in their address? Whether it be balls of the feet, back on the heels, midfoot. Any feedback on that? Let's see, I'll type this in. You guys can answer the poll. Option 1, we're going to go balls of the feet. Option 2, you may instruct heels. Option 3, we'll say arch or midfoot. All right. So the poll just went out. Love to feel all you guys would answer, just so I can get a good idea of what's current and what's being taught out there.
And by all means, if you can't unmute, feel free to just shoot in the chat box too if you have something different.
Yeah, absolutely. Absolutely. So I got a couple votes, arch, midfoot. 3, wait, maybe for 1 or 2 more votes to come in. But that's good. I mean, that, I don't want to say that necessarily, that kind of follows the suggestion of this concept of equilibrium and the science that goes into balance. I know there's been a shift away from this. Balls on setup, left heel in swing. Okay, yep. So some counterbalance work there. Okay, great. So again, there's no one correct way to instruct a student on how to set up. I think there should be some variance based off swing style. But what we find is that when the weight of the feet, when the weight goes through the balls of the feet in setup or heels, back on the heels in setup, that it leads to more deviation and maybe a little less stable movement in general, right? In golf, in training, and in all different types of activity. So when we think about the weight being on the balls of the feet, and we think about athletes that do that, what comes to mind? Basketball players, linebackers, athletes that need to change directions, right? With very dynamic footwork and movement. Now, I'm not saying that golf isn't dynamic, but when we think about that stability, mobility chain, we want as much stability from the feet to promote proper function of the rest of the joints up the chain. If the weight is forward, right, then the tendency of a golfer will be to lift up, right? Think if you were to stand up and put your weight on your toes and then start doing something quick, such as rotating or swinging, if you don't counterbalance and bring your body back, then you're going to fall on your face. Right? The opposite is true. If you start back on your heels, you're way back on your heels, and you start swinging fast and you don't bring your weight forward or your body forward, then you're going to fall back on your butt. So we see that having weight under the balls of the feet, or sorry, not the balls of the feet, the arches of the feet or midfoot, will promote more efficiency in movement and more control in movement, right? Now, talk about setup and a weight on the front of the feet. We see certain setup characteristics when we detect a golfer is on the balls of their feet. It tends to promote S posture. So you can see here in the image, you'll see if you look at the pelvis and lower spine, there's a bit of an excessive arch in that back. Golfers that set up with S posture tend to have poor rotation in their backswing. They'll tend to end up in reverse spine angle. They tend to get a poor pivot. Pivot will define as rotation in the lower body without excessive elevation, right? So poor pivot could lead to sway or slide. And that's because when the spine is arched, the lower back is arched, the hip joints aren't aligned properly and don't rotate properly. We see steepness in the swing. We see the head drop. Essentially, we see inefficient rotation, right? And this S posture for some golfers comes from having the weight of their body on the balls of the feet. This is pretty simple to fix. Education is pretty much all it does. So what we'll do often with golfers that are having balance problems, we'll have them stand on 2 feet, close their eyes, ask us where their weight is. We find that golfers that set up with S posture after their eyes are closed will then become aware that their weight are out on their toes. When we bring it back to midfoot, the posture tends to fix itself. Sorry, the weight distribution tends to fix itself. Greg, do you want to show them pelvic tilts and golf set, or rather, let's show them hip bar hinges with an emphasis on having the weight centered.
Okay. So you're thinking just like hip hinge?
Yeah. So this is a great way to kind of educate your student on how to set up with proper posture while maintaining even weight distribution on the midfoot.
Yeah, so basically what I'm looking at, and this might be hard to see on video because it's going to be hard to see if I'm on my toes, my heels, but I'm basically going to take a golf club, or in the gym, I might use a PVC pipe, and I'm going to put it right under the crest of my belt, right in where the hip joint, where the leg meets the pelvis, right? And what I'm going to start doing is I'm going to hinge, but there's a specific way to do this. If I just lean forward, all the weight's going to go onto my toes, right? So I want to take my big toe, my small toe, and my heel, and I'm going to grab the ground so I know my entire foot is grounded. It's centered in the arch. And from that position, I'm going to hinge by pushing my hips backwards. Right now, what that's actually going to look like is a golf posture or a linebacker posture or a shortstop. This is a more athletic position. Most people tend to get their reflection from other areas, so it has to come more from the hips. You always kind of hear people saying, like, stick your butt up, people will arch their back, all right? But you want to actually have that be a hinge. So that way, if I were to have a plumb bob on my center of gravity, it should be right in the middle of my arch, not necessarily out here or not back here.
Okay, thanks. So that's a great way to just educate, instruct a student on how to set up with neutral posture, with even weight distribution. When those things fall into place, we'll see 10 other things improve, right? So the easiest way to start improving movement patterns with a student is simply thinking about equilibrium, balance, neutral posture in the setup, which I'm sure a lot of you guys already know a lot of this information and spend a lot of time on. So learning how to hip hinge, learning how to pelvic tilt, really important things. All right, and conversely, when we see weight back on the heels, it tends to promote a C posture, right? A C posture creates issues with spine rotation. So the more flex we have in the thoracic spine, which is the upper spine, the less the thoracic spine rotates. That's why, this rounded shoulder posture is really, really detrimental for golfers. A simple way to clear this up, kind of independent of other issues, again, is bringing their center of mass or their center of gravity to a more neutral place on the foot, midfoot and arch, right? So again, if you're working with a golfer with C posture, have them get in their stance, ask them to close their eyes, ask them where their weight is. More times than not, it's going to be back on their heels, right? Back on the heels leads to C posture, leads to poor shoulder turn and separation in the swing, right? So just same issue, opposite direction. Again, there's just more information on ideal weight distribution, neutral spine, weight evenly distributed, promotes a good pivot, good separation in the swing, and a good weight shift. Okay, so we're going to turn away from poor weight distribution. We're going to go to the next fault, which would be a poor pivot. So again, I'll kind of define a good pivot as good rotation without excessive elevation. Essentially in golf, it'd be the ability to turn your hips to the right or to the left without hiking the hip in either direction excessively that we would call either reverse pivot, sway, or slide. So there are numerous reasons as to why a golfer may have a poor pivot. It could be tight hip joints to the trail side, right side, or to the left side. It could be weak glutes. It could be due to the issue of setup that we were just talking about when it comes to weight distribution. It could be a lack of balance, a lot of different things that can create a poor pivot. Now, the way that we would determine what physically creates a poor pivot is through the functional movement testing, right? So we use those tests to determine why a golfer may suffer from this fault, the poor pivot. And then from there, we'll know exactly what we would need to do or what you would need to help your student with to fix that issues. So depending on the issue, all right, we're going to show you a couple of different fixes. Greg, let's start. If a golfer has tight hips and doesn't pivot well, they have reverse pivot, sway, or slide, what would you do in terms of mobility to help improve hip joint rotation?
With mobility, I would definitely work on just general hip rotation. So there's a lot of different ways to do that. For those of you guys, yoga has become very popular in golf. And one of the things that in yoga they call the pigeon pose. It's one of probably the easiest exercise to do. Now, if you have hip replacements, knee replacements, it's different, right? So what I'm going to do to get into a hip rotation stretch, this is going to be an external rotation stretch of my left leg. I'm going to be down on all fours. I'm going to swing both feet as far as I can to the right, and I'm going to drop my right leg behind the back. And what that does is that actually stretches the hip right through here, the entire glute. Now, most people tend to do this incorrectly where they're going to lie on their leg. I actually want the knee outside the body and the foot outside the body, right? That's probably one of my favorite ways to do this. For those of you who have bad knees, I think that's one of the common faults. I'll go up against a door frame. And another way to do this is if I'm in a door frame, I'm going to take one leg and just cross it over and rest on the door frame, not swivel chair usually. And that's going to, again, it's going to put my hip into external rotation. And you should feel a tolerable stretch. Anytime we talk about stretching or releasing and mobility, this shouldn't be painful. You should have a comfortable stretch. So that's probably the main way to start working on hip rotation to prevent sway and slide. And then do you want to jump right into the clamshells?
Yeah, yep, let's go into clamshells.
So basically, as you kind of mentioned, we're working on releasing those muscles, and then the big muscles to help strengthen it. We've already talked about the glutes. So we talked about bridging, but the muscles that tend to prevent sway and slide and help rotation are the glute medius, the sides of my hips. So staying in a down position. Again, this is probably an exercise we do with a majority of our golfers, especially that are fairly new to exercise. I'm sure all of you guys, depending on your age range, have seen the old clamshells of the Jane Fonda Dirty Dog exercises. Where most people do this wrong is they move their pelvis. This is not designed to be a pelvis exercise, right? So same thing, I'm going to at least activate my core to keep my spine stable, to keep my pelvis stable. And keeping the heels together, we're just going to rotate the knees apart, okay? And by all means, if you guys want to try this, you can, but if you have enough ground space. If you do this correctly, it's only going to take about 15 or 20 reps, and you're going to feel that glute medius on fire. If you're just flailing your pelvis as well, you could do this for 100 reps and you probably wouldn't feel anything. So when we do a glute activation series, we'll add clamshell exercises, and we can also work on internal rotation where the knees are together, heels are apart, right? And then we'll actually work on a hip abduction. Again, all these muscles have to do with preventing sway and slide and improving rotation. So we'll go clamshells, reverse clamshells, leg raises, and then keeping the leg raised, we'll actually work on what's called a windshield wiper or a corkscrew, depending on who you're talking to. And by the time you do 15 of each one of those, that entire pelvis, that entire hip should be on fire. So all those small muscles that surround your hip will be working. So I tend to put those hand in hand. You work on the mobility of your hip, and then you strengthen the muscles around it.
Yeah, great. Now, so that's for somebody that has poor pivot, poor lower body rotation, a golf swing that suffers from tight hips. Now, another reason why a golfer may have poor pivot, may suffer from sway, slide, reverse pivot, could be they failed the pelvic rotation test, which if you think back, it's the upper body stable and the lower body is pivoting and rotating, right? Somebody who has good loose hips or mobility in their hips may fail that test regardless because they lack the coordination to do it. So, Greg, if you're working with a golfer that fails the pelvic rotation test and does have sway and slide in their golf swing, what would you do for that?
Yeah, honestly, okay. So before I go into the ones on the screen, one of the things I want to do is I want to get them more supported. All right. So if they had the inability to do this in a standing position, right, I would probably most likely start them in a grounded all forward position and just work on the mobility. Okay. So if they get here and they're still stuck, that tells me there's probably going to be more release work that needs to be done. Once they start working through the spine and has the mobility of the spine, we'll start getting them up in a standing. So again, I'll use a club so that way they still have some type of stability. So they can create a little bit more stability with the upper body to help work on range of motion of the spine and the pelvis. Right? And then kind of going down the line of the next in that phase, if I go facing forward, I still have stability and I can work on that hip swivel or hip rotation. So if you can see this club that's in the center of my body, I shouldn't see it going out to the side, out to the side. I want a rotation. And then the better you get with stability, you can slowly work to be without stability.
Exactly. Right. So there are other things here, but you're starting to get the gist, right? Swing fault, body issue, failure in functional movement tests. And these are just great examples of ways to clear those issues up with some really basic exercises that you guys, most of these you could do right out on the range with your students on the spot. But it starts with the concept of knowing how to objectively assess movement patterns, which of course we have taught you at this point. All right, let's keep going here. Let's get to the next swing fault, poor rotation or poor turn. Poor turn, what we're really talking about is separation of upper body from lower body. So good upper body rotation. Mostly what we're talking about here is going to be a little bit more relevant in the backswing. All right, so poor turn is going to be from poor spine mobility, poor stability in the lower body, a lack of mobility in the head and neck, a lot of different things that can lead to poor rotation of the shoulders. So the way that you would want to assess if you have somebody that has poor turn in the backswing is, again, with functional movement testing. I think the one, Greg, that you should probably review again is the torso rotation test, right? And then let's show them open books.
All right, so make sure I'm still on the screen here. So just a reminder, as one of the functional movement tests that we did is the torso rotation test. So again, I'm going to ask people to get a developed posture, arms across their chest, and without moving their lower body, I want to see how well they can move their upper body. Okay. Now, again, from that position, you may see people, there's a couple of things that we're going to look for. I only mentioned briefly the range of motion, but if I tend to see this, that's not a rotation exercise. That's one side being forced by the other. Or at the fact that I could get here on one side and maybe only here on the other. All right, so that's what we're looking for in the test. Now, for the purpose of the open books, I'm going to tip this down a little bit more so you can see me. There's a couple ways that I like doing this test, and I think a lot of things that places that you used to see is a little bit different. The old school open book, the knees were down. Now, the problem is if my knees are down, that allows my low back, the area that's supposed to be stable, start to rotate too. So I always like bringing the knees higher as long as they're comfortable with that position. I'm going to try to keep the knees together. So again, that's stabilizing my pelvis. And I'm going to reach across with my arm. And I'm trying to get my shoulder down to the ground. So I'm trying to hold the rotation of my pelvis and create separation with my shoulder. This isn't about how far the fingertips go. It's about getting the shoulder down to the ground. And again, whether you're doing this for reps or time or anything else, depending on the programming, but for the most part, we're just trying to get more separation. And you'll find one side could be worse than the other, depending on how it's tested as well.
Yep. So the open books, when we're looking at a golfer that can't separate and has poor upper body or shoulder turn, addresses mobility. Now, for other golfers, the reason why they can't create separation by turning their shoulders away from the hips is due to a lack of stability in the hips. Just to save some time, one of the best ways to improve stability in the hips is by working on the bridge exercise, which Greg has shown you a few times. There's other things we can do, such as banded walks around the ankles. Greg, I don't know if you want to demonstrate that real quick. But again, different golfers, different issues. There's no one size fits all. It's either going to be they're tight in their spine or they're weak in their hips. So Greg's got a good strength exercise for the hips. if you're working with, most times it's going to be a junior golfer that has this issue, or more likely female than male, right? So men, older men especially, tend to have stiff thoraxes, stiff thoracic spines. Juniors and female golfers tend to have poor pelvic stability, right? So for those golfers, Greg's going to show you a duck walk or a lateral walk.
In my opinion, this is actually probably one of my favorite exercises that even as people progress through my programs, this is actually part of their warm up at some point. So this tells me they've gotten past the clamshell exercises, right? And you'll see band walks. And I'll warn you, if you guys have a lot of clients that are on Instagram, you see this a lot. The key is not just having the band around your knees and walking. You really want to make sure the knees are pressed wide. Right, so when they're stepping, I should never see the foot go outside the knee because now it's just collapsing. This is all great, also great for ACL prevention in your female athletes as well. So I'm going to get them in golf posture, same thing, hinging from the hips, and that matters because if I'm not in golf posture, it becomes a quad exercise. If I'm in golf posture, as I'm walking laterally, so I'll go this way so you can see me, wide knees, again, you're going to start to feel those lateral glutes really light up. And again, depending on the program, there's different foot positions you can do. But the key is the leg position in the band, not just the fact that you have a band on and you're walking. I see that a lot.
Yep. All right, cool. All right, so that's a great fix if you need a golfer who needs more stability in their lower body to create better rotation in their backswing or separation in their backswing.
Also very cheap and can just go in a golf bag.
Yeah, you can go in a golf bag, bring it down on the range. Easy to do. And as Greg said, it's a great dynamic warm-up for golfers. Gets their core engaged, gets their glutes engaged. Really good for warming up. The next swing fault that we'll go over quickly is flat shoulder plane. So obviously you guys know what flat shoulder plane, it's when there's a deviation away from starting spine angle in the backswing. This can be caused by weight through the heels in the setup, poor posture or rounded shoulders in the setup, restrict shoulder turn, which leads to spine lift. Remember, if we're not rotating back, we're probably lifting up, and that's what flat shoulders is. Poor stability in the pelvis or in the glutes. So doing that exercise that Greg just showed you will address that. Limited shoulder mobility, right? So if we see somebody who can't externally rotate the right arm or the trail arm, that could potentially lead to obviously a chicken wing, but a lift of the spine and shoulders. And then in terms of functional movement, if you failed the hip rotation test, pelvic rotation test, torso rotation test, and the 90-90 shoulder rotation test, those all correlate, not cause, but correlate with the flat shoulder plane issue in the golf swing. So C posture, the cause of flat shoulder plane due to C posture. The way that we would work a golfer through that from a physical progression is make sure that they can touch their toes, whether that be stretching the hamstring, strengthen the glutes, or both. Go through bridge progressions and go through abdominal progressions. Those things tend to clear the setup and help improve posture for the golfers that do set up with C posture. That's lower body. The upper body C posture cause would be tight pecs, right? So the pectoral muscles in the front, and then weak muscles between the shoulder blades, right? So that's more traditionally what we would think about doing. If we're rounded, we'd want to stretch the front of the chest, strengthen the back of the chest. Greg, I think it'd be great to show them some type of chest stretch, since this is a very prevalent issue with, I'm sure, a lot of you golfers with the rounded shoulders. Showing them a pec stretch or a chest stretch is a great way to help them improve their posture.
Absolutely. And even, again, depending on who has the ball, you can absolutely do a chest stretch over the ball where you're just lying on the ball, extending over. But these, you're probably going to start seeing these all over the place. Every gym has them now. Most golf clubs are starting to carry them. It's simply a foam roller, right? It's a $20 piece of foam. It's the easiest exercise I've ever given any of my clients, right? But for the most part, what I'm going to do is I'm basically just going to sit my hips down, make sure both my hips and my head are supported. And my goal is to just be able to relax my arms so they can fall to the ground. If you're very tight, you may not be able to allow your arms to fall, so I may have to start here, right? But my general rule of thumb with this chest stretch is for every hour that you're stuck behind a desk, teaching, driving, you owe me at least a minute on the foam roller. So if this is just 5 to 10 minutes at the end of the day, and what you'll feel is those shoulders will start to drop and the tension of the stretch will slowly relax. It's just a long, comfortable stretch. Easiest thing I would give most people to do, but it makes a big difference. You could do this for a few minutes and then lie flat on the ground and you can feel more of your body, more of your torso resting on the ground.
Yep, great. So I guarantee you that is a stretch that probably every single one of your students would benefit from. And what is the primary fix for us for that C posture setup that's so damaging when it comes to shoulder turn.
And I'm going to add one thing there. We work with a lot of juniors here in Sacramento. The junior circuit here in Northern California is phenomenal, but they have all just been stuck behind desks way longer than ever before. All my junior golfers now have quote unquote old man issues. They can't do a toe touch. They have horrible rounded posture because they spend all their time like this. So all my juniors are having to start to do that as well, because we need to fix those problems before they start getting older and getting tighter in those fixed positions.
Yeah, absolutely. All right. More causes for flat shoulders, more physical limitation that causes flat shoulder playing in the golf swing. Poor mobility in the spine and torso. It could also be a strength issue in the spine and torso. So, we're getting a little bit low on time, so we're not going to show you all these exercises, but there are a lot of things we can do to address that. If for any of these things, these exercises, you want to learn more exercises, just let us know and we'll help you out and direct you to the right place where you can see videos and things like that. Somebody that has poor hip mobility, pelvis mobility, or strength could also suffer from flat shoulder playing. Okay, let's keep going. Let's get to the next fault. All right, here's a big one, poor rotation impact, right? So what percentage of your students, when you're looking at kind of that down the line shot at impact, what percentage of them have really good pelvic rotation at impact? My guess is probably not many of them, right? And there are a host of physical limitations that lead to poor hip rotation to impact. Could be a lack of lead side for right-handed golf or left hip internal rotation, right? So that's tight glutes, tight hip muscles. Could be weakness in the trail side glute. So if I'm a right-handed golfer, if my right glute is weak, then it's going to make it difficult for me to turn my right hip to the left to get my hips open before impact. Poor stability in the torso. If the torso isn't stable, then the hips really won't have much opportunity to get ahead of the torso in the downswing, which could cause timing issues in terms of their ability to get there in time, the hips that are to impact. Limited spine rotation back creates issues, and failed functional movement tests, such as the overhead deep squat and toe touch test. Now, those failing the deep squat test and toe touch test lead to postural instability. And when we start lifting in the golf swing, we stop rotating. So while those tests don't look rotational, they affect it very much. And then, of course, pelvic rotation and the torso rotation test, a little bit easier to kind of grasp how those would affect the ability of your golfers to move their lower body well and turn their lower body well in the downswing. All right, so in terms of fixes, we already addressed in a few different categories, limited hip rotation. Greg showed you the hip stretches and clamshells, poor pelvic rotation. If they have failed the pelvic rotation test, working on glute strength, we saw the hip twister. There's a few swing drills that you could do. So what we're starting to see is that there's a lot of crossover and carryover between these issues, which makes it a little bit more simple to fix. Continuing with fixes. Greg, why don't we do quickly a half kneeling chop? This is one of my favorite exercises to improve stability of the upper body, to then in turn improve rotation of the lower body.
Yeah, absolutely. So this is also an exercise that I see done a lot, but I also see it done incorrectly a lot. So before I add resistance to a rotation, right, just starting above that, the half kneeling rotation is I'm going to stay in the half kneeling position, right? And I can use a club just to stabilize me, right? Because the problem is if I just move my shoulders, right, I'm not rotating, okay? So when I lock up my shoulders, I'm actually working on rotating the thoracic spine in both directions. So I want to make sure they have the ability to move. We started with a release. Now we're working on movement. And then when you start focusing on strength, right, this is not about how heavy the weight is. It's the quality of range of motion, right? So again, if I add resistance, so I'm gonna have my inside leg up, I'm gonna be behind the pulleys. If I add resistance, but all I'm doing is moving my arms, right? That's a shoulder exercise, and I can't guarantee that's gonna make them better at rotating, right? So I'm gonna keep my arms up in front of me. I'll lower myself down so you can see I'm gonna try to keep that gap, that triangle, and I'm gonna try to rotate my entire torso. So the buttons on my collar is facing the attachment. And when I come down and across, again, I'm getting my torso to rotate in each direction. So it's a great exercise when done correctly, but if done incorrectly, it could potentially actually cause more problems.
Great. Thanks, Craig. All right. Loss of posture. This is pretty much anything we talked about here has the potential to lead to loss of posture. Poor glute strength, bridge leg with extension tests, poor pelvic tilting, the inability to touch your toes, the inability to squat, the inability to create separation between torso and pelvis, and a lack of shoulder mobility. So this is probably one of the most, I would guess, the most common swing issues you would see with your golfers, especially the high handicappers, is change in posture. I would say the first two things to look at when you have a golfer that has changes in posture through the swing, whether it be in the backswing or the downswing, is the toe touch and a deep squat. Can they touch their toes? If the answer is no, we know they're way more likely to lose their posture. All right, and do what you can to help them with that. Can they do a deep squat? No, then we know that golfer is more likely to have early extension or lift in the downswing, right? And you can kind of direct them to somebody to help them with the deep squat. In terms of fixes, all right, we're really thinking about glutes, bridging. Again, we're always coming back to the glutes. You can see how they influence almost every single one of these things. Abdominal exercises such as pelvic tilting. Greg showed you an example of that on his hands and knees where he's rocking the pelvis back and forth. That's called cats and dogs. Pelvic tilting in golf posture. All these things train the abs how to contract properly in the golf swing, which will, of course, add stability for your golfer and potentially prevent them from losing their posture. Toe touch exercises. We do two variations. We do toe touch with toes up, heels up. Greg, do you want to show them that real quick? This is a really good one, an easy one to do out on the range.
Let me see if I can pass it real quick.
We still have the fat back.
Toes up, heels up.
Oh, yeah.
So basically, the purpose of the toes up, heels up is basically just elevating your either toes or heels. So what we do with this is basically a way to deactivate the hamstrings to help get a better stretch. So when I elevate my heels, it's getting rid of the tension of my ankles. I'm going to use a foam roller. I'm just going to kind of squeeze in. You don't need a foam roller, but this is a good way to help deactivate. And I'm just going to squeeze in on the roller, reach all the way up, all the way down. And I'm just going to do that 10 times. And then I'm going to do the same thing, but now I'm going to put my toes up. So putting my toes up now puts more tension on the calf. So I'll get more little tension behind the knee and the hamstring as well. So again, go all the way up to the ceiling, down to the ground. And ideally, this is actually a fun one that you can test right away. And you can see a change in a few inches just by doing that. And then since it's on the leg lower as well, I'll find the door frame. Sorry if I'm too far back here. But I'll put my leg up on the door frame. Probably my favorite hamstring stretch. Right, but when you work on the lower of the off leg, you're actually getting more tension, deactivation, and stretch on your up leg. And then I would obviously just allow that to rest after that. Yeah, we tend to do this with hamstrings versus this test because it takes the back out of play and it just focuses the stretch on the hamstring.
Yeah, great. So that's a great one to try tonight for all of you who couldn't touch your toes, right? We know the inability to touch your toes potentially leads to posture loss in the golf swing. Working on your toe touch with your toes elevated and heels elevated forces your body movement and coordination to change. I mean, oftentimes we see when somebody can't touch their toes, they do those drills. 2 minutes later, they're touching their toes. It's not that we changed anything about their hamstrings. We just changed their coordination and movement pattern. So that's a strong one and a really important one. Again, loss of posture. If you don't squat well, you probably will lose your posture in the golf swing. Different things here that we're not going to go through right now. But working on mobility and your ability to squat, that's going to be really beneficial for a golfer who is losing posture. And then working on torso separation. So the ability to rotate the torso independently from the pelvis also would benefit a golfer who tends to lift up throughout the swing. right? That skill of creating separation, shoulders from hips, really important for improving the consistency of ball striking for your students. So again, these are all things you can suggest. I will say, if you go to our website, fitgolf.com/exercises, all this stuff is on here. You can look up categories, you can get PDFs of a lot of these things we're showing you. And if you need any direction, you can just ask us. Reverse spine angle. So when we turn the shoulders back, if the spine starts leaning towards the target, that's how we would define spine angle. The causes of that would be a failed shoulder raise test, a failed toe touch test, pelvic tilt, pelvic rotation, and torso rotation test. Can all lead to reverse spine angle. Fixes, one of the great fixes for the shoulders as it relates to spine angle is the chest stretch on the foam roller that Greg showed you. There's a few others here that you can find on our website in the exercise database, but primarily with the shoulder fix for golfers, you will always do well by loosening up the chest and strengthening the shoulder blades, right? So that's always a good direction to point people to who have shoulder issues and posture issues as it relates to their golf. The fix for spine angle in terms of pelvic tilt would simply be working on pelvic tilts. Greg showed you a couple of those exercises. The inability to touch your toes leads to reverse spine angle. We just talked about that at length. So I know it's getting a little bit of repetitive, but we just wanted to really show you that oftentimes all of these common swing faults relate to a body issue that's kind of cross categorical, right? So oftentimes the reason why a golfer isn't turning well to impact is the same physical reason as why they're losing their posture in their golf swing. So from that, it becomes really easy. If you can just learn a few functional movement tests, and you've learned a little bit today on things or exercise you can do to improve their functional movement, chances are you'll be able to make a pretty significant dent on eliminating these issues, these common swing faults from a physical perspective. Okay. Now, Lynn, I don't know how we're doing here on time. I don't know if we're going to get to this case study or if we have a volunteer. How are we doing, Lynn?
Jason, we're pretty much near the end here, Jason.
Okay.
So I don't know that we'll have the time for the case study because I want to give an opportunity for questions, and I already see one. But yeah, so that's where we're at, Jason.
Okay. Let's see, questions. I got one. How can we get TPI certified? I think it'd be a great idea for all you guys to get TPI certified. You know, it's a little bit of money. I think you can do it all online now. You can just go to mytpi.com. And level 1 is for fitness professionals, golf professionals, physical therapists, pretty much anybody that wants it. And it takes what we're learning here and goes way more in depth. So it's a little bit more material, but it'd be a great one for everybody to try to get the TPI certification if you're interested in learning more about this stuff.
Jason, what do you recommend? And that was tremendous, by the way. Thank you, Jason. Thank you, Greg, for showing and demonstrating the exercises themselves. What could we do during a lesson, with some bending, some stretching, without making a situation worse, but almost, doing it with a student without telling them what we're working on? Do we have some bands nearby? Do we keep a ball nearby? Do we keep a roller, the foam roller nearby, that type of thing?
Greg, you want to answer that one?
Yeah, I think with the conversations that I've had with a lot of golf pros, they're already working with a lot of stuff. You always hear about they want to focus on the one swing thought. So once you start introducing too many things, it could get dangerous. So usually I try to keep it fairly minimal. And I think the golf pros that I've worked with, they've done really well by giving them just that one thing that they can do for homework on a regular basis. So that way they can still work on the things that they're working on technique-wise. And once they say, hey, real quick, let me just check something real quick. Let me do a toe touch test. You run through the toe touch and say, okay, so I'm going to show you real quick, but I just want you to do this at home on a regular basis. So the key is really giving them the stuff that they need to do on a regular basis, because very rarely are you going to find one quick fix that's going to make this miraculous change in their body that day. So it's just getting them to understand, okay, you have tight hips. This is what we're working on in your swing. And as you address this at home, we'll get better at doing said drill from various. So you don't necessarily need to bring a ton of stuff out there, but it's good to have the knowledge so that way you can just pick and pull from a test, give them a test, give them a fix, and allow them to do it.
All right. Greg, thank you. So we have a question from Courtney. Courtney, thank you. Good stuff, guys. Best options for personal health. Best options for personal health.
Courtney, call Greg. That's your best option.
So, Michael, thank you for bringing that up about the TPI certification. I will, a shameless endorsement for Fit Golf and Jason and Greg in particular, as I did visit Greg in Sacramento, and particularly that I do is the chest stretch. Just laying on the foam roller, it's 3 feet long, it's 6 inches wide, 5 minutes every morning. And Greg, I don't know if this was unintended consequences, but a lot of my neck pain went away because of doing those chest stretches as well. So, keep it simple, which that is. And so I thank you for that. And Greg, would you mind your contact information, please?
Yeah, what I'll do is I'll just put it in the chat box, and then I'll kind of let Fran jump in with some of the stuff that we're doing with you guys and the NCPGA.
Okay, great, Greg, thank you. So Fran, we'll turn it back to you. We missed you at the beginning, but you're here now. And again, Senior Vice President of Business Development for Fit Golf. And Fran, thank you so much for bringing everybody to us today.
Sure, Len, and we want to thank you for inviting us, and we want to thank all you that took the time to take this course. We know it was a good solid hour and 45 minutes, so we're not going to keep you much longer. But I do want to go over a few major points where Greg was talking about equipping yourself, but make it very minimal, picking just one item or one test to utilize. But I want to let you know that you have tools to help you with that. If you go to the site fitgolf/exercise, there's a whole library of, I'm guessing it's hundreds of exercises, all broken into body parts. So all you have to do is take a look at how their body's moving, then go to that site, pick a body section, and that'll give you all kinds of exercise to utilize. So it's not like you have to learn this overnight, but it's nice to have resources. The other resources are all PGA. If you talk to Len, as a matter of fact, I'm going to suggest everybody calls Len on their cell phone and ask him how to get a hold of all these tools. But there's several tools out there. One of them are 52 weeks of 1-minute exercises. Another tool is a Golf Fitness Resource Center where you can plug in one of your students, or you could give them the link to plug in what they feel is their weakness. Is it consistency? Is it pain? Is it distance? And they can plug into an automated system that once they choose one of those 3 factors and then choose a body focus after that a program is automated for them to come to them on a weekly or every 10 days based on those the restrictions they feel they have. So there are tools for you to use for yourself and your students. If you need to know how to get to those tools, just communicate with Len through email, or and I'm sure he'll forward it to me, and I'll get you whatever tools you need. There are no costs for those tools. It's all developed by the PGA sections anyway. So the other thing I wanted to clarify is that we have nothing to do with golf swing instruction. We don't know that world. We always move them over to you. And that's why when Jason was talking about that assessment that determines a golf fitness handicap, if their handicap puts us in a position where we can't really help them, the first thing we do is ask them who their golf instructor is. Sometimes we even get that golf instructor on the phone to have a team conversation, but we move them over to you. We have nothing to do with the instruction part. Okay. The second thing is that if we talk about TPI, we have I get asked all the time. So what's the difference between you and TPI? We are all TPI certified. All our locations are, all our trainers are. As a matter of fact, the CEO of this company is on TPI's medical board. So they value our information as much as we value theirs. And I have a course that's designed to create golf fitness businesses throughout the country. And that is being sold on the TPI site. So we have a really, really strong relationship with TPI. So there is not really a difference there. We're all interested in improving the golfer so that not only so that they get better, but so that they have that curiosity of their body's movement and take a question to you, the golf instructor, and ask, what do I do next? That's our whole goal. Okay. By the way, my information, I should put it on. If you wanted to email me, it's first initial last name is F as in Frank, Rosario, ROSARIO @fitgolf.com. I'll put that in the chat. Okay. All right. Any other questions?
Well, thank you, Jason. Thank you, Greg. Thank you, Fran. And I think, as we watch and see the amount of research that has gone into this and how Fit Golf has really come to us for years now, specifically on the golf swing and applying these exercises and making us all better. It's been just tremendous. So appreciate that. And we'll continue our relationship with them. Again, it's Greg Johnson at fitgolf.com. 207-233-1501. Email me, call me. Of course, I'd love to talk to you as well, and we can pass along the information. And finally, for all the PJ members that are on the session today, please be sure that we have your member number and name that you attended so we can get some MSRs posted. 2 MSRs today, and just there's always a commercial, right? Where June 14th is the last day of the period, so stay tuned if you need a bit more. I put my email there, ldumas@pjhq.com, and Shelby S.Zell, Z-E-L-L @pjhq.com, of course, to make sure that we have your MSRs reported. Other than that,
Len, one quick correction. That would be G Johnson. He put it back up in the chat. His first initial last name.
okay, what did I say?
fitgolf.com.
All right.
Okay.
Good. Whatever. Forget what I said. Remember what Fran said. Awesome. Okay. Thanks, everyone. We'll keep going.
You see in
Please be
reverse.
safe. Yeah, please be safe, and we'll see you as we go along. Take care.
Great. Thank you, guys.
Thank you, everybody.